Deliwe, here we are for part 2 of the interview, and we are going to get started with a little bit of a heavier topic, and this is, what do you think will take to eliminate gender-based violence?
Thank you, Ronny. For me, I feel if we are to eliminate GBV, we have to make sure that GBV program is being mainstreamed in all the government departments and in all the programs that have been implemented either by the government or by non-government organizations. Like the way how HIV was done, it was mainstreamed in all the programs. So that was why we managed to move strides in that. So I also believe if we take the same approach for GBV, I feel we will reach there. We are really going to eliminate it. My other second part is we also need to use different approaches, and it still has to use the multi-sectoral approach. But all in all, I also strongly feel that if we can use the socio-ecological theories of change, we approach the GBV using the socio-ecological theories of change, I believe we're going to reach there. Because we are going to look at different levels where we are looking at an individual level. We need a person to understand this, and really a person has to start with an individual to say, no, GBV has to stop and it has to end here. Then if an individual has made that decision, then that individual can even have an influence in his family or her family. Then as a family, because that's where we normally influence each other. Then from family level, now we are engaging the community. So at community level, where we are using different approaches like the gender norm change, interventions and all that, then few people who have made the decisions individually or at family level and you meet at community level, then now you are a team. Then now you start working together as a community. And even the different organizations or institutions, if they have the resources and they come in like we are doing, and the other partners, they should also come in, then we are a team and we are supporting those communities which have already made a decision to say, for us, we need change and we need to stop. Then I believe at the end of the day, then we are going to make it. And I believe we are going to reach there.
Wow, I like your hope, Deliwe. Yeah. Anyway, you touched on this a little bit earlier, but can you go a little bit deeper into what is the role of men in eliminating gender-based violence?
So for me, I'm looking at men. They have got a very big role to play in this. Because in most cases, as much as we say GBV affects both males and females, but if we look at statistics, it's females who are mostly affected by GBV, and mostly it's being fueled by these men. So for me, if the change has to be there, the men themselves, they have to be highly involved, and they have to be the ones who should start fighting for that. And these men should be taking leading roles by standing up against GBV. And they should be the ones who should be able to say, no, this has to stop here. And the other part is, like earlier on I talked about, we have male models in our program. So if we can have a lot of those male models who should be reaching out to their fellow men in the community, I believe a lot of things could change. And even for those male perpetrators, if they can have those models, they even start those support groups where they can learn how to avoid getting in conflict with their spouses. I believe at the end of the day, the instances will reduce and eventually they'll be stopped. And the other part, I also look at male as key, because they also need to lead by example in their homes, especially for those who have children in their homes. Because as children are growing, they are looking up to their parents as their millers. They copy everything and anything that we do, whether it's right or wrong. For them, it's the best because that's what their parents are doing. So they are looking to us, and we are always promoting or having issues with the GBV in the homes. Our children feel like that's part of life. But if we lead by example, we are role models to our children. At the end of the day, those children will learn that, in my home, what I rent is GBV, it's not acceptable. Then they will grow up as responsible adults who always fight for those who are being victimized in GBV.
Deliwe, can you tell us about in the last couple of years now, right? 2 years, or
Yes.
we've been in tough COVID times. How has this impacted the GBV prevention work?
Yeah, for us, COVID has really affected the work, the GBV work, like the households, because we are serving the ultra-poor communities. And some of the households, they can't even afford a phone. So it has been so difficult for us to reach out to those households. And even in some of the GBV issues, it means they went unreported, because most of the issues, we hear them when we go to the households for our service provision. But now with the restrictions to visit the households, then it was not easy for us to reach out to those people. And especially where we provide psychosocial support, where I was talking like we are referring them for other services, this was not happening. And especially for those caregivers who are reserved, like the introverts, they couldn't just share the information anyhow. But in this scenario, it means they just kept quiet and they had no one to share their stories with. So it really affected those incidences. But for the few that we reached out through the phones, they were able to report the incidences, and we are able to support them accordingly. So it really affected us.
Wow. Deliwe, with this in mind, how can we build back better with prevention in mind for GBV?
Yeah, for me, for us to build back and better the post-pandemic recovery for COVID-19, I look at it like now we have to intensify the gender norm interventions and the gender-based community awareness to catch up with the lost time. Otherwise, we are really behind, like in reaching the numbers and even providing all the sessions that we are supposed to provide. We are lagging behind. So if we can really catch up on that, we really need to intensify on that one, then we can do better. Secondly, for me, I'm still looking at the angle of the women empowerment economically. So if now I really want to support women by giving an injection into their social fund, so that it can be used as a revolving fund, so that women who lost their businesses because of COVID, they can access soft loans and restart their businesses so that they can be economically empowered. And as I earlier on said, that if they're economically empowered, then the issues of GBV, they reduce in their homes, then I think we can do better in those angles.
Deliwe, thank you so much for highlighting today the importance of economic independence for women that are so they don't become trapped in the GBV situations where the abuse is not just emotional and physical, but also financially. And also thank you for reminding us the importance of having male role models now for our young children and also for other men in their families. And again, thank you for taking time out of your day and coming and speaking with us a little bit on GBV. I appreciate you, okay? Thank you.
Thank you, Ronny. Bye.
Bye, Deliwe.